My name is Maureen Shelton, and I'm the Director of Education for Spiritual Health at Emory Healthcare. Wanted to spend a few moments reflecting on grief. We are in an unprecedented time. We have so many different feelings of uncertainty and maybe feeling unsettled. There's so much happening right now in our world, and you all are involved on a day-to-day basis in so much complexity. And wanted just to shine the light for a moment on how part of this dynamic that we might be experiencing and feeling is grief. Both individually, we have so many things happening in our personal lives, so many factors we're tending to that are changing, as well as communally, we are so aware of one another's vulnerabilities. So I wanted just to reflect on a process around being in relationship to our grief. First, we can greet it, allow it to come. This can happen in small windows as well as larger windows of time when we are in places of safety. But even as we're going from room to room, we can just check in. Let me just greet if I have some grief and acknowledge it's there. Then we can listen to it. See what information it has for us. And then we can respond. We can respond by reaching out to others, to asking them to hear us. And when we hear one another's grief, we can just really listen. We don't need to give any advice or perspective in that moment, but just allow it to come forward. We can also respond to it by remembering many sources from our faith tradition that have wisdom and insight, as well as theories of grief, which help us see it more objectively and understand that there's nothing wrong with us when we feel disoriented, when we are not thinking as clearly, that we all can go through this orientation, being oriented, then disoriented, and then becoming more reoriented, hopefully as we care for ourselves. Elizabeth Kubler-Ross's work on grief is still so helpful to remember that we all go through cycles of denial, anger, bargaining, depression, and acceptance. And this is not linear, it's cyclical over and over again. There's a quote from the Psalms that I wanted to bring forward that I came across yesterday from Psalm 84, verse 6. Who passing through the vale of tears makes it a well. In addition to greeting and listening and responding to our grief, we can see how can we tend to ourselves in the midst of the valley so we can make these tears a well of strength. We can recall from our faith tradition the many sources of strength. For example, from my tradition, the Christian tradition, we can look through our hymnody and sing those songs. How firm a foundation, rock of ages cleft for me, let me hide myself in thee. God's eye is on the sparrow, and I know God watches me. From our many varied and rich faith traditions, we all have different things we can pull on, really relying on our daily prayer practices and maybe integrating this piece of listening to our grief can be part of how we engage our daily prayer practices. One of the things that I see as another source of strength as we walk through the hospital, and I've heard this from other chaplains as well, that with this sense of potential grief and vulnerability, there is this tenderness that's present throughout the halls of the hospital, where staff are looking each other in the eye with a knowing look and honoring one another's presence and personhood and courage. This sense of this tenderness and the communal strength and beauty that can shine forth in the midst of this tenderness can be a resource for us in the midst of this valley as well. In closing, I would like to read a quote from Leonard Cohen from his song Anthem. Ring the bells that still can ring. forget your perfect offering. There is a crack in everything. That's how the light gets in. So as we go through this time of being in the midst of the valley, may we tend to our grief. Notice how the tenderness surrounding us is also shining a light on our strength. And may we reach out to one another. And please feel free to reach out to Spiritual Health or the Faculty Staff Assistance Program. We are here for you. Thank you for being there for all of our patients and family and for one another.